guys, I'm here to show you how to do a venous puncture while using the evacuated tube system. First, we want to create a sterile fill while using a chuck. The next thing you'll need is a tourniquet, the right size gloves, making sure they're not loose or any gaps are in between the fingers, gauze, alcohol pads, Band-Aid or tape, depending on if your patient has a latex allergy. You want to make sure you have your evacuated tube, your hub, and your double-headed needle. You also want to make sure you have a trash can nearby, a sharps container, and a biohazardous container. Today, I'll be using a dummy arm. The first thing you want to do with your patient is to evaluate them. Make sure they're not on any blood thinners, have any restrictions on this arm, or are allergic to latex. Once you have evaluated your patient, you want to wash your hands. After washing your hands, you want to see if you can locate a vein in between your patient's AC. If you can't locate one, you want to use a tourniquet. You want to place your tourniquet 3 inches above your patient's AC for no longer than 60 seconds. The purpose of the tourniquet is to make the vein rise a little closer to the surface. Once it's up there, you want to use 2 fingers and see if you can find a vein. Once you have found the vein, you want to pop your tourniquet. Next, you want to apply your gloves. And open your equipment. You want to open your alcohol pad, your Band-Aid, and make sure your evacuated tube and gauze are nearby. Next, you want to take off the black part of your double-headed needle and put it in a sharps container. And you want to attach the hub to the needle, making sure that it's tight, but not removing the top from the needle. You want to place it down and tie the tourniquet again. Once you tie the tourniquet and can locate the vein, you want to wipe the area of the skin, starting from the vein, working outward, making sure you don't cross the already wiped area. Let the skin dry for a few seconds. Next, you want to take the top off the needle, making sure the bevel is up. Next, you want to go in at an angle and puncture the skin. Once the bevel is in the skin, you want to apply the evacuated tube to the needle. Of course, on the real patient, blood is going to fill the tube. Once you start seeing blood, pop the tourniquet. You want to let the tube fill up and then take it out and place it down. Then you want to fold your gauze in 4 sections, slowly removing your needle and applying pressure to the vein. You also want to make sure that you put the needle in the sharps container as soon as you're done. If your patient isn't on blood thinners, you can have them put pressure on it for 2 minutes. If they're on blood thinners, you want to have them put it on there for 5 minutes. Once they apply pressure, you want to take your Band-Aid and cover it. You want to dispose all other objects and the biohazards, including your gloves. There we go.